If Lyme disease has affected you or your family or anyone you know for that matter, you've probably heard that the diagnostics that are out there that you'll get from your standard doctor are terrible. The question is, why? My name is Nicole Bell, and I am an author of What Lurks in the Woods and also the Chief Business Officer of Galaxy Diagnostics. And what I want to talk about today is why is Lyme testing and testing for other tick-borne diseases so freaking hard? So first, the basics. Lyme is caused by a bacteria called Borrelia burgdorferi and is transmitted from a tick bite. The CDC estimates that there's 500,000 new cases of Lyme disease diagnosed every year, and that's only one of the nasty infections that you can get from a tick. The harsh reality is that the diagnostic standard of care for some of these tick-borne diseases is about as accurate as a coin flip. But why? What is the science behind why these organisms are so difficult to detect? Well, that's what I want to talk about today. First, I want to talk about the types of testing. So if you're thinking about diagnostics and what you're going to get out of a lab test, what are the different types of testing that you need to know about? We learned a little bit about this during the COVID epidemic, and so we should have a good background, but I want to go into the detail of what that means. First, there are three major categories of testing. First, antibody testing. So this is your immune response or the host immune response to the pathogen itself. So you're not actually looking for the pathogen, you're looking for how your immune system responds to the pathogen, specifically how you produce antibodies. There's different types of antibodies. IgM, IgG, IgMs come first, IgGs come later, and we're basically measuring what you have in your bloodstream. This is called an indirect method because you're not actually measuring the pathogen, you're just measuring your response to having that pathogen. And antibodies last for a long time, and we'll talk a little bit more about what that means and how that impacts your testing results. But the second and third types of testing are direct methods. Here, you're actually looking for the pathogen itself, and how you're doing that can be one of two different ways. Again, think back to COVID. You might have heard of an antigen test or a PCR test. Well, what does that actually mean? So PCR is a type of nucleic acid testing, and what this is doing is it's looking for the DNA of the pathogen itself. So again, here, this is a direct method because you're looking for the actual pathogen. Then the third type of testing is antigen testing. So here, instead of looking for the DNA of the pathogen itself, you're actually looking for proteins or molecules that are secreted by the pathogen. So these antigens are specific to the bug that you're looking for, and they're released by the pathogen, sometimes as a defense mechanism, sometimes just part of its normal life cycle, but you can use the detection of those antigens to determine whether or not the pathogen is present. Another direct testing methodology. Most doctors, especially if you just go to your primary care physician, they're going to order the standard of care diagnostic test, which is currently antibody testing. Again, looking for your immune system's response to these pathogens. You might hear different words or different labels for these types of tests. The standard two-tier test, the modified two-tier test, an ELISA, an IFA, Western blot. All of these tests, fancy names and acronyms, they all measure antibodies. The problem is, antibody testing is extremely limited and has a lot of problems for the detection of infectious diseases. And this is something that you need to understand because this is the type of test you're most likely to see. And so what is it actually telling you? So I'm going to list through some of the problems associated with antibody testing. Problem number one, antibody titers or levels peak weeks after the infection. Right? It takes a little while for your immune system to respond. If you've been bitten by a tick and you've been infected, you want to know right away because that's when treatment is most effective. Unfortunately, antibodies take several days to weeks to reach their peak levels. So I mentioned two types of antibodies, IgM and IgG. There's more, but we'll focus on this for right now. IgM comes first, and they're not as specific, but they peak sooner. Later on, your immune system gets a little bit more sophisticated and develops IgG antibodies. But the peak can be several weeks after you've been infected. And again, treatment is most effective as soon as you get that tick bite and you want to get rid of that bacteria before it starts making camp in your body. And so it's really not a great method for early diagnosis. Problem number two, we're all different. and our immune systems are all different. And so the same bacteria can lead to very different host responses within different individuals. Here's an example with monkeys out of Tulane University. They've infected a whole series of monkeys and found different host patterns emerge in terms of antibody development. So here's two fancy graphs looking at different antibodies to Borrelia. Same strain infected into each monkey, but completely different host responses. And this makes sense, right? We're all unique. We all have different exposures. And so we're going to have different immune responses. And that means that using antibodies as the standard method of test is complicated. So using antibodies as a method of diagnosis is kind of flawed because it assumes that we're all going to have the same response, or we're all going to produce similar antibodies, or at least enough antibodies. And what we found in the research is that just isn't true. Problem number 3, these pathogens are seriously sneaky. A pathogen or a bacteria like Borrelia has all sorts of different mechanisms it uses to hide and suppress from the immune system. It releases antigens to confuse the immune system. It sends out signals to kind of take the defenses that we have and confuse them. It swims faster than any of our immune cells, so it can get away, and then it hides in tissues that all of our immune cells can't get to. And Borrelia can penetrate into parts of our body that are considered immune privileged. That means our immune system doesn't have full access to do its thing. And as such, it can kind of hang out for a while, which is very difficult for your immune system to clear, and also difficult for it to develop the antibody response that you need. Problem number 4. Antibodies equal exposure, but antibodies do not equal current infection. We learned this in COVID, right? So I've had COVID a few times. I've also been vaccinated for COVID. So if I get measured for COVID antibodies, I'm going to test positive. But does that mean that I have COVID right now? Sure doesn't feel like it. But that's what antibodies tell you. Antibodies tell you that your immune system has seen the bug, and then it develops antibodies so that if you see the bug again, then it can develop a response and protect you. So if I test positive for antibodies, it doesn't necessarily mean that I have a current infection. And this is part of the challenge that we have in tick-borne illness. Because it's the standard of care test, it's especially challenging for people who already know that they have had a tick-borne illness. Maybe you got diagnosed, maybe you've been treated, and you still test antibody positive. Well, that's what your immune system does, and that's what it's supposed to do. It doesn't necessarily mean that you're still infected. You could still be feeling badly because maybe you do still have a Borrelia infection, maybe you have a co-infection, or maybe you have some immune dysregulation. In order to figure out which bucket that you're in, you need to be able to test for the pathogen itself, not your antibodies. And that's where direct detection comes in. So the compilation of all these problems is not good for patients. The result is that the standard of care diagnostic test is about as accurate as a coin flip. Studies have shown that the standard test is about 49 to 65% sensitivity. This was results from a systematic review. Where it lies depends on which type of test that you use and which lab you go to, but at the end, not good. That means that 35 to 51% are going to test negative even if they have the disease. Again, not okay. And so at this point, you might look at me and say, we learned this from COVID. The experts came out and said, don't use antibody testing. In order to tell whether you have an active infection, either get a PCR test or an antigen test. So why don't we just do that? But for many tick-borne infections, antibody testing is all we've had. So why don't we have PCR and antigen testing as part of the recommended standard of care? Well, we're going to talk about that. What's the science behind why these tests have been difficult and what you need to do in order to do them successfully? So, the challenge with direct detection. What is it? What do we need to do in order to do this right? So it's really important to understand your adversary. A bacteria like Borrelia is what's known as a stealth pathogen. So what does that mean? Well, stealth pathogens are below the limits of detection of conventional methods. So you take something like PCR, and it has a limit of detection. If you take an acute pathogen, here I have an example of E. coli, that doubles pretty quickly and gets to high copy numbers in your bloodstream pretty fast. And so if you run a PCR, you're gonna pick it up, you know what you have, you get the right treatment. These stealth pathogens don't work that way. Instead of doubling and replicating on the order of minutes, they take hours. And again, they evade and hide from your immune system. And so that makes them really difficult to capture in a blood sample. And so you may actually have the pathogen for years before you can pick it up with conventional test methods. So, below the limit of detection. Well, how much below? Borrelia is reported to be in concentrations as low as 0.1 bacteria per milliliter of blood. This is 3 to 4 orders of magnitude below the detection limits of conventional PCR. So sometimes that's hard to actually visualize in terms of the numbers. So let's make it real. The probability of detecting Borrelia in a blood sample with conventional PCR or qPCR is about the same as the lifetime chance of getting hit by lightning. Is that something that you want to bet on? I don't. But problems were meant to be solved, right? We put a man on the moon, so clearly we can figure out how to detect these organisms, even though they're sneaky and even though they're in low abundance. And you know what? We can. There are techniques that you can use to lower the limits of detection so that you can actually directly get at these pathogens. So again, it's important to understand the adversary. What are you up against? Where do they hide? What do they do? You really need to know the microbiology of these pathogens so that you can figure out the best way to detect them. First, what pathogens are we even looking for? And there's lots of them. Here we have a short list of the top pathogens that you're gonna see, but it includes a bunch of organisms and microbes that can make you really sick. And so you wanna know which ones that you might have and what you have gotten from that tick. We've got Borrelia, the causative agent of Lyme disease. We've got Bartonella. We've got Babesia, we've got Ehrlichia, we've got Anaplasma, Rickettsia. They're all different, and you want to know exactly where they are and how to find them. So where do they go in the body? This is really important because some are easier to detect than others. So organisms like Babesia, Ehrlichia, and Anaplasma, they actually infect different types of blood cells. So they're much easier to capture and detect in a blood sample. An organism like Rickettsia infects vascular cells that line your bloodstream. And so some of those cells slough off and they're in moderate copy numbers. So again, also able to detect in a blood sample. But organisms like Borrelia and Bartonella are much harder. So Bartonella also infects vascular cells, but it's in low copy numbers and it only circulates through the blood on a periodic basis, like once every 7 days when it needs to do so as part of its life cycle. So it's a little trickier to capture in a test tube. Borrelia doesn't like to be in the blood at all. It actually hides in tissues and isn't easily detected. And so that really influences the way that you go about trying to implement your method of direct detection. So kind of summarizing this and looking just at a graph, okay, what's the likelihood of detecting these organisms in blood? Well, things again like Babesia, Ehrlichia, Anaplasma, Rickettsia, they're a little bit easier to get with conventional methods because they are more regularly in the bloodstream. Bartonella, a little trickier. Borrelia, very tricky. And so you need to understand what types of methods you should use for which organisms. Okay, so how do we enable direct detection? Which technologies can we use? Well, just as a reminder, we have 2 methods that we can use as part of our arsenal to do this direct detection. We have nucleic acid testing, or things like PCR, and then we have antigen testing. One's looking for DNA, one's looking for molecules secreted by the pathogen. And there's a bunch of different techniques that we can use to lower detection limits to get at these sneaky little bugs. First, we can capture them. Analyze a large volume of sample, capture it by some sort of technique, and then concentrate it into a smaller volume so that you can test it, right? Start with a large volume, concentrate it down into a smaller volume. You're going to have a better capability to detect these sneaky organisms. You can also grow these organisms. You can take the sample that you collect, culture it, and then the pathogen concentration will increase. Now, some of these pathogens are tricky to grow, so you need to make sure that you grow them in the right way, but it is possible. And then all of a sudden, maybe you started with one organism and it turns into many organisms. And so that's a good way to increase your sensitivity by getting more of your bugs in your sample. Another approach is partitioning. So this is some of the advanced PCR capabilities and technologies that have been developed in recent years that are really exciting. And what do I mean by partitioning? Well, you have one sample, and if you make one measurement on it, it's going to be tricky to get something that's in low abundance. If I have one needle in a big haystack, it's going to be really hard to find that needle, isn't it? But what if I take that haystack and I divide it into 10,000 or 20,000 little piles? Well, the needle's going to be in one of those and it's going to be easier to find. And that's what modern techniques have allowed us to do with PCR. It's going to increase your sensitivity and reduce the noise of all the other stuff in the sample. And then finally, target. Choose your samples wisely. As I mentioned, Borrelia is in really low concentration in blood, so maybe we should think about another sample type that we can utilize. So here's an example about how you can use some of these different methods to improve our limit of detections. Borrelia is known to secrete these antigens to help thwart the immune system and hide. These antigens actually collect within your bladder and get secreted out through your urine. And so you can actually use that to your advantage and use it as a method of detection. So these antigens are secreted in urine, but they may not be in concentrations that you can detect them easily. But again, we have techniques. We can use capture and concentration. And this is exactly what was done at George Mason University. In their work, they demonstrated that you can actually concentrate the sample over 2,600 times. So you can take a large volume of urine, capture the things that you want, those antigens, and get them into a small volume, which allows you to detect them accurately. So in that paper, they looked at 24 acute Lyme patients and compared the results from the standard of care antibody-based test to the antigen-based test in urine. Standard of care test had sensitivity in the mid-70s. The antigen test had 100% sensitivity, so a significant improvement over the current diagnostic standard of care. Another example is Bartonella. Researchers at NC State have done a combination of growing and partitioning, those two techniques I talked about, in order to get better results with Bartonella testing. And what does better results mean? Well, if you take conventional qPCR with a high-risk patient population of 38 patients, which they did in their 2020 study, they only got 8% of those patients to test positive, 3 out of 38. Using the grow and partitioning method that they developed within their lab, 18 patients were detected, and so a 6x improvement in the detection rate among that same patient group. Huge increase in sensitivity, which is critical for those patients that were left out. Those 15 patients now know exactly what they have. So newer methods are available and they are out there. I mentioned earlier I work at Galaxy Diagnostics. Both of these tests are commercially available right now. It's time to demand better. For more information on Lyme disease, visit Lyme Warrior's website. They have patient-centered videos, blogs, all sorts of information that can help you on your journey with tick-borne illness. You can learn more about me on my website, NicoleDanielleBell.com, and you can order my book, What Lurks in the Woods, on Amazon. And for more information on diagnostic testing, visit Galaxy Diagnostics' website.